If you are dating a severe avoidant who works in healthcare, this may be one of the most confusing dating situations that you ever experience, and here's why. So in the early stages of dating, we get to know someone. They tell us about what they like, what they don't like, their interests, their hobbies, what they do for work. And they tell you that they work in healthcare. It may be allied health, it may be medicine, it may be mental health. All of these professions that are inherently associated with kindness, empathy, trust. And then you may hear them talk about work, how much they care for their patients, how much they enjoy what they do, the wins that they've had, the advocacy that they are giving their patients. And this can be incredibly attractive. But what can happen is the longer you are dating them, the closer that your relationship is getting, this empathetic creature that you think that you are dating is just not showing up to the party. This is where we have to remember about attachment theory and our attachment injuries. They refer to the close interpersonal relationships. So the closer you get to someone, the more likely that those attachment injuries are going to get activated and amplified. So when you're working in healthcare, it is a patient-practitioner relationship, and you've got all of these professional boundaries in place. They are not the same interactions as friends, as co-workers, as family members, and your romantic partners. So if you are dating someone who has more of a severe avoidant attachment style, they may thrive in healthcare, but because it allows them in a safe way to give a lot of kindness, give a lot of empathy, give a lot of that caring nature that they have, and it's protected by that boundary. You're not going to have to get closer to someone. It is very safe, and there's no expectation of getting care back from the patient because you are just giving it. That is what they are there for. You are there to help them. So it is very important to remember, if you are dating someone that works in healthcare, you need to pay attention to how they are showing up in your relationship. Because yes, it may be incredibly attractive how kind and caring they are with their patients, how much they love and care about what they do. But just because someone works in healthcare and has a lot of kindness and empathy and is great for working with patients and a great advocate for their patients, it does not automatically mean that they are going to be an emotionally safe person to be in a relationship with. And another thing that many severe avoidants who work in healthcare do is intellectualize the living shit out of their attachment injuries. And I say this as someone who has done it in the past. We have that health literacy, we have that medical knowledge, we can understand things at quite a high level. So we may be able to talk about our traumas, we may be able to talk about attachment theory to the nth degree, but that does not automatically mean that someone has integrated it. So behavior trumps words any day of the week, and especially behavior towards you in the relationship dynamic. So I am interested, any of you watching who have dated a severe avoidant who works in healthcare, how have you found that experience for you? Drop a note in the comments.